Assalamu alaikum and hello to everyone. My name is Fatima Mariam and I have recently completed my MPhil in Epidemiology and Public Health from University of Veterinary and Animal Sciences, Lahore. The topic which is I'm going to present today is identification of the risk factors associated with the severity of COVID-19 in the Pakistani population. First of all, we should know that what are coronaviruses. Coronaviruses are one of the largest group of viruses that are enveloped positive sense RNA viruses with a large genome and a unique replication strategy. Previous outbreaks that are caused by these viruses include severe acute respiratory syndrome and Middle East respiratory syndrome. Its first case was identified in Wuhan, China in December 2019, and the index case in Pakistan was confirmed on 28 February 2020 in Karachi from travel history from Iran. On February 11, 2020, it was designated as coronavirus disease by WHO, and the WHO declared the disease as a pandemic on March 11, 2020. This virus has caused huge health losses, social losses, and economical losses. Therefore, keeping in view the significance of the disease, the current study is designed to identify risk factors that are associated with the severity of COVID-19 in the Pakistani population. The main objectives of my study are to identify the risk factors that are associated with the severity of COVID-19 in the Pakistani population and to identify high risk groups and provide evidence to develop targeted prevention. Materials and methods. A cross-sectional study was designed to identify risk factors associated with the severity of COVID-19 in the Pakistani population. For this purpose, a questionnaire was developed after review of literature and discussion with medical professionals. Then the questionnaire was pre-tested on some patients, and the final questionnaire had 35 close-ended questions. The link to the questionnaire is added here, as you can see in this slide. The data on various plausible factors is collected from 276 confirmed COVID-19 patients, and the patients who had not been tested positive to COVID-19 and some of the cases with missing information was excluded from the study. The data was preferably collected through personal and telephonic interviews. However, a link of the Google form was shared where the patients were not available for a direct interview. All statistical analyses were performed with R for Windows software and RStudio as an interface. Descriptive statistics, including percentages, were produced for each variable of interest. A univariable analysis was performed using chi-square test to select the potentially associated variables. Then multivariable analysis using ordinal logistic regression was performed on those variables which yielded a p-value less than 0.2. In the final model, the only variable showing a p-value less than 0.05 was retained, and the ordinal logistic regression model was operated with the help of polar function. Odds ratio and 95% confidence intervals were produced by X function. Results. This slide shows the demographic characteristics of the patients. We divided our patients into three categories according to the definitions of NIH, and the three categories were mild, moderate, and severe. Out of 276 patients, most of the patients belong to the moderate cases, and some were mild cases, but the severe cases were very few. As you can see here, the most of the patients in our data were male patients, and the COVID-19 affected although all the ages and all age groups, but Most of the infected individuals were of middle age and old age. The frequency of severe cases was higher in old age as compared to other age groups. About half of the patients in our study belong to the overweight category, and mortality rate in our study was slightly higher in overweight patients as compared to the patients with normal weight. Obesity commonly enhances the severity of respiratory diseases, but it is still not confirmed whether the obese patients are more likely to have greater illness or severity. This graph shows that the mortality rate in our study was 6%. Most of the people, about 65% of the people, told us that they did not require any hospitalization but they took treatment at home, and 14% of them required normal ward and room hospitalization. About 8% of them were admitted to ICU, and 13% of the patients told us that they did not require any treatment at all. This table shows the signs and symptoms presented by COVID-19 patients, and as we can see that the most common symptoms in them were fever, coughs, and aches. About 59% of patients told us that they totally lost their sense of smell and taste during their disease period, and half of the patients experienced gastrointestinal symptoms such as nausea, diarrhea, and loss of appetite. This table shows us the results of univariable analysis. Different type of comorbidities like cardiac diseases, lung disease, and diabetes were observed in the patients, and the results of univariable analysis showed that the severity of COVID-19 was slightly higher in patients with diabetes and cardiac disease. However, this association could not be confirmed through multivariable analysis. Similarly, it was found that the here you can see this. Similarly, it was found that the severity of disease was significantly less in patients who were routinely taking anti-allergic medicines before and during their disease occurrence. 18% of the patients used ivermectin with or without the prescription of doctor during their course of disease, and 21% of the patients used steroids during their disease period. This table represents the results of multivariable analysis. And the results of multivariable analysis revealed that the age was significantly associated with the severity of COVID-19. And we found that the odds of moving from mild to moderate and moderate to severe category were 44 times higher in patients with age more than 70 years compared to the patients of age less than 30 years, and the odds was 5.9 times more for the age group of 50 to 70 years than the patients of the age group less than 30 years. So we can conclude that the patients over the age of 70 years who were infected with COVID-19 had 44 times higher odds of getting severe disease. Although there was no mortality in patients aged up to 30 years, this does not suggest that they are fully resistant to the disease. 70% of the deaths associated with COVID-19 were found to be among adults of age above 70 years. The most common symptoms found in our study were fever, cough, and aches. Thank you.